Let's follow up with three members of Parliament on the questions about the vaccine plan. Steve MacKinnon is the Parliamentary Secretary to the Minister of Procurement. Karen VECCHIO is the Deputy House Leader for the official opposition Conservatives. And Jenny Kwan is the Deputy Health Critic for the NDP. Good to see you all. And Mr. MacKinnon, let me start with you. We've heard a variety of dates now in the last couple of days. Again today for vaccines to be available in Canada. Heard some more about details today about cold storage and preparations. Can you tell us with any precision when Canadians can expect to see the vaccinations begin in this country?
Well, look, I think we've been pretty clear that this is going to start to roll out after the new year. But Peter, I think if you'll indulge me for a moment, what's pretty clear is that we don't have an approved vaccine. There has been no approved vaccine anywhere in the world. Regulators are, of course, including the Canadian regulator, which is a gold standard regulator around the world. But the regulators, of course, are taking up very quickly the case of these rolling submissions that they've been receiving, looking at clinical trial data. We're obviously following that entire process.
But to be fair, I mean, it's true. There are no approved vaccines, perhaps, but countries have detailed plans.
Well, I would actually put you on the spot on that. We've been very clear that we're working with provinces. Canada has a well-worn immunization process, logistics, distribution networks. We do it all the time, whether it be children in school, whether it be the flu vaccine. 16 million people got the flu vaccine this year. Canada is very good at immunizations. We, of course, are going to supplement that existing distribution system, including by providing equipment, whether it be low temperature freezers, whether it be syringes, gauzes, swabs, and the like.
Okay.
So we have a major supply challenge. But Peter, the plans have been proceeding apace, and normally hundreds of people are working on this 24/7. And when a vaccine is ready,
you'll be ready to go.
We'll be ready to roll it out.
Okay, Karen VECCHIO, the government points to the Health Canada approvals process as reason for the vaccination delays, justified by the fact that Health Canada wants to make sure the vaccines are safe. So what's wrong with putting safety first? And what do you point to suggest there isn't, in fact, a plan when Mr. MacKinnon says, look, it's all happening behind the scenes. It'll be ready to be rolled out as soon as we get vaccine approval?
Well, they indicate that it's always behind the scenes, but first of all, I think it is. It's ultimately to ensure the safety for all Canadians, so I understand the health approvals, that is necessary. But then we have to look at everything else that goes along that. Working with the premiers, working with the provinces, and they've talked about this rollout, what they're going to do. Are the Canadian Armed Forces going to be part of that plan? What is the plan for our North and for our Indigenous communities? We know that we're in a huge country, so this is not just a small thing that we're taking on. And making sure that we're working with the provinces and territories to make sure that vaccine gets rolled out as quickly as possible.
But do you see evidence that that's not happening? Do you see evidence that we've had some premiers say, look, they want more clarification? What do you point to suggest Canada's not ready?
Well, I think specifically the Premier speaking out and just saying, I think it's one of those things that tomorrow when it drops, that we're rolling to go. And that we want to make sure that the logistics and everything are in place, making sure that the airplanes are ready to go, making sure that the troops, if that we are working with our armed forces, that they are trained. There's so many things that we need to do here. So putting all the pieces in place, and when the vaccine comes, then roll it out and have everything there. That's just something we haven't seen. We haven't talked about the coordination. They've talked about just we've got all of these doses. Well, we haven't seen the doses. We don't know how long the approval process is going to be once it does get here. Canadians just want certainty.
All right. Jenny Kwan, the NDP suggested today that, look, notwithstanding that there's a process from Health Canada, we should be stockpiling vaccines now. How does that work? If the vaccines haven't been approved, how do we stockpile them in Canada waiting for approval?
Well, in the United States, for example, they are in fact stockpiling. So that is to say that the vaccine is being shipped and is being warehoused. And the minute that the approval is done, they will immediately be able to deploy the vaccines and for their citizens to access them. We're suggesting that Canada should in fact do the same. And that would expedite the access to vaccines for Canadians who are desperately waiting to get access to the vaccine. It would help the small business community. It will help our seniors. And so, that's something that we should do, and it could potentially save months of waiting.
Mr. MacKinnon, is that an idea worth thinking about?
Well, look, Peter, I think the chair, I can say it no better than the chairman Moderna, who said that Canada is in the front row of nations. Moderna, of course, being 2 of the now 4 vaccines, all of which we have concluded agreements with, by the way, who have submitted applications for Health Canada approval. Canada, it is said many times, it bears repeating, we have a very diversified, extensive, deep, and wide portfolio of vaccine candidates.
Yeah.
And of course, when Health Canada approves a vaccine, tells Canadians that it's safe after an independent process, a rigorous process, then we will, of course, roll that vaccine out according to the contracts that we have established with these vaccine candidates.
But today,
that
I mean, here we are
saying.
today. Why can't your government say today, tell Canadians, look, here's the plan. If the vaccine arrives on this date, here's what happens on day 1. Here's what happens on day 2. Here's what happens on day 3. Here's how we do the refrigeration. Here's how distribution will occur, how it will get to the provinces, who gets vaccinated first. Where's all that information?
The logistics of this are obviously a very large enterprise, Peter. But again, Canada has a well-worn vaccine and immunization logistics system. We are going to lean into that heavily. We're going to supplement that, of course, as has been referenced, with the Canadian Armed Forces, with additional equipment, with additional materials that we're all of which we are procuring. And I don't know that it serves Canadians to say, if on this date this, and if on another date that. We are going to
not
do
so
this
much that,
in a
but once
proper. We're going to do this on a proper way.
Right.
We're going to have a vaccine approved. Then we are going to, as Moderna has said, we're in the front row.
Okay.
We're going to receive that vaccine, and we're going to roll it out according to a plan that we're working through with provinces and territories.
Go ahead here.
Well, I hear all the things that he's saying, but I think Canadians want that certainty. We know right now that small businesses, that families, that many people are going through a crisis. And right now, this is certainty. We want to know from our government what is going on. And by providing, it may not be an exact date, but give us a greater period in time instead of saying sometime in January, sometime by the end of this first quarter of 2021. Those, to many people...
But how can they know that? How can they know that date without a Health Canada approval?
Well, no, what I'm saying, well, you've even asked when it arrives, when are you expecting it to arrive, and start working at that plan. We might not know the exact dates, but we do have a much better idea than what the government is leading on to us to lead.
Okay, Jenny, let's hear from Jenny Kwan. What more should the government be doing here?
Well, the government actually basically are just reciting the same old talking points, and they're not giving the certainty to Canadians that, in fact, they do have a plan. When I suggested that, the NDP suggested that the government should, in fact, get ahead of the game, and that is to say stockpile the vaccine right now and have it, in our warehouses ready to roll out the minute Health Canada approves. That will save months in terms of the rollout of the vaccine. They can't even give you a straight answer on that. They're just going back to talking points. And once you have the vaccine and once everything is approved by Health Canada, then what is the plan? So tell Canadians, right, who can be expected to be at the front of the line to get access to the vaccine? How will it be distributed to the provinces and so on? Those are the details that we're all looking for. Those are the details that will give us comfort that, in fact, the Canadian government has a plan. The talking points is not doing it.
Mr. MacKinnon, let's shift gears a bit here. We only got a couple of minutes left, folks, so fairly quick answers here, please. I want to bring in the fiscal update. Clearly, a plan to spend up to $100 billion over the next 3 years to relaunch the economy, Mr. MacKinnon. Prime Minister pointing out today that's a different approach, he says, to what we saw from Conservatives in the recession of 2008. What's the point he's making here?
The point he's making is that we're going to see Canadians right through this process. We've been there from day one. With supports, income supports, supports for business, wage subsidies, rent subsidies. We're going to make sure that the PPE rolls out right across the country as is required. We're going to make sure that vaccine gets to Canadians and that we get through this together. All of the resources for all of those things will be put in place, and we're not going to stop till we get Canadians right through this process. But Peter, we are going to need to rebuild an economy. The Prime Minister's been very clear about that. We're going to need to make sure that the supports are there for whether it be women to re-enter the workplace, whether it be for strategic infrastructure or what have you. We're going to be there and we're going to have the resources.
Thanks very much. So I think the bottom line is trying to compare the 2008-10, the recession, to where we are now is very different, especially when we're dealing with the health pandemic, this entire part. It's just not about businesses closing. It's not about issues with trade. This is an issue where we're seeing full lockdowns of some of our communities, and knowing that people are unsafe going out there with some of the health concerns, long-term care homes, all of these different issues that we have to deal with. I look at the report that came through last night, extremely concerning, because I think at the end of the day, we are looking for a plan. We're looking for a big plan. We're not saying let the economy shut down and then we'll rebuild after. How can we do this in parallel? How can we have the vaccines? How can we have rapid testing? How can we make sure that we have a strong economy?
Jenny Kwan, let me hear from you on the plan unveiled by the government. This could be a confidence, some elements of it when they're voted might be confidence issues, and so we'll see where that takes us. But Jenny Kwan, on this plan released yesterday, what are your thoughts?
Well, I have to say I was very disappointed with the economic update. You know, Canadians are very worried, they're very stressed with the pandemic. And, you know, the government should know that, in fact, the ultra-rich are making record profits. So I was looking to see whether or not there was going to be any signal that there would be a wealth tax, and so that on the pandemic profiteering, that there will be some return back to Canadians to support Canadians during this difficult time. No wealth tax, no profiteering tax, nothing new on housing that is substantive in addressing the homelessness crisis, and promises of pharmacare, you know, decades long, and still we don't have any signal from the economic update in that regard. And we're in the middle of pandemic. People need medication.
Next thing thank you all. Next thing we're watching for is when some of these measures need to be voted on in legislation. We'll see where the parties stand on that. Thank you all for your time tonight. Appreciate it.
Thank you.
Thank you, Peter.